In this video, we are going to see the INICT 2024 questions, recall-based questions in OB GYN. Okay, so I get this thing from a Telegram group, and I don't know how much it is sure. It's just a recall type. Mostly, this topic and this kind of question they asked. Okay, that I can be sure. So let's start it. The first question. The first question is a woman present with the bleeding for 2 days and abdominal pain. LMB was 6 weeks back, and the USG shows the fluid in pouch of Douglas. What is the diagnosis? As you know, the four options up there: approach to placenta, that is a detachment of placenta from the uterus; placenta previa, that is a low-lying placenta; and then the missed abortion, ruptured ectopic pregnancy. In all these cases, you will get the bleeding, and the one thing that you can rule out, that is a USG shows the fluid in pouch of Douglas. In out of the four options, that's only option you can get it, like a ruptured ectopic pregnancy, right? Second one, which is a contraindicated patient with atonic PPH, postpartum hemorrhage with a history of hypertension. That's the most important thing. History of hypertension, which is contraindicated, ergotamine, right? Yeah. Then, which will cause what? Contraction to your blood vessels. Okay. So let's come to the next question. That is the most potent natural estrogen. Most potent: estriol, estradiol, estriol. Which is on estradiol. Estradiol. D. That means it is most common in the reproductive age group. Okay. And then come to the fourth. Let's come to the fourth question, which is the patient presented with 36 weeks of chronic hypertension, 3 plus proteinuria, and PP 170, which complained of headache, blurring of vision, and all. So it is preeclampsia. Preeclampsia in 36 weeks. What do you have to do? You have to expedite the delivery. And what is the medicine you have to do? Labetalol and magnesium sulfate, right? So let's do the next question. That is the fifth question. That is 18-year-old with the primary amenorrhea present with OPD. She is having TANA stage 4. Secondary sexual characteristics are present. Her karyotype is 46XX and FHS is 5, LH is 30. What is the diagnosis? For 46XS, we can take Mullerian genesis, and we can avoid the other androgen insufficiency syndrome and gonadal distances. It is like a what do you say, that exclusion we can do it in here, and also for the secondary sexual characteristics and FHS level and LH. Okay, I think that's enough. I'll show you this one. You can differentiate this. And then the sixth question, that is the primigravida, which is on second stage of labor for 2 hours. So, and having the head at the 3 plus at catfoot present there, and fetal heart rate is dropping to 90 BPM. What is the best paid delivery? Outlet forceps, right? So direct question, which is not seen in pregnancy: monoamniotic dichronoid, which is not going to see in pregnancy. And then the dose of corticosteroid for lung maturity. For 2 types of corticosteroid, we can use Dexa and betamethasone. For Dexa, dosage like 6 mg, 12 hours, 4 doses. And for betamethasone, that is 12 mg, 24 hours, 2 doses, right? Everyone must know this thing. It's a current direct question. And which is the criteria which is for IUG are accepted? Abdominal AC is less than 3rd%. That's true. EFW, that is estimated fetal weight, is less than 3rd%. Absent of reversal or diastolic blood flow umbilical artery. That's true. Uterine artery pulsation indicator should be more than, not less than 95. Okay, that's the correct answer. Then following the preterm baby, the baby died in the NICU despite of all effort, and the medication which given to the mother reduced the breast tenderness. So in this case, what we need to give? Cabergoline. Cabergoline to do what? It will reduce the high platin level, right? So let's come to the 11th question. These are some kind of direct question. I don't think so. This is the same question which is asked in NICT, which is seems little bit easy. So the patient. 11th question, the patient with O negative and the husband is B positive. Okay, the delivered baby, and she received the anti-D prophylaxis at 28 weeks, and which of the following condition will give you the anti-D post-delivery? So if the baby is again positive, then the risk factor is there, right? And what do you have to check? The DCT, that is direct Coombs test. If the direct Coombs test shows the antibodies in the body, if there is no antibodies in the body, you have to try it again. So if the baby is positive and DCT is negative, which means it is an indication for giving. And the woman with history of painful genital ulcer, you got the answer, right? For the painful genital ulcer 1 year back, has a neonate 1 week, has a lessons on the face and the body. What is it? Herpes, right? So quite an easy direct question. I don't think so if they ask this easy questions there. just a recall based. Okay, the patient present with 18 weeks with a low risk of trisomy, quadruple marker with a high risk of NTD. What you have to do? Anomaly scan at 20th week, right? And let's come to the 14th question. The young girl present with retention of urine and cyclical abdominal pain. Examination, there is a tense bluish bulge. So you got it, imperfect hymen. Direct question again. And the woman present with the dysuria and the yellowish discharge. See, yellowish discharge and shows the gram negative diploc. Okay, what is the diagnosis? Dysuria, right? And then come to the last question. Let's go to the last question, that is 16th one, which shows the decreased sexual maturity, hypogonadism in the men in deficiency of what? Zinc. Direct question they asked. I think from my viewpoint, this is like a NEET PG question only. I don't think so. This is the exact question they asked in INICET. This should be a little bit more details will be there in INICET somehow. And this is more like the NEET PG type of question. So actually, please refer this question, guys. It is really important for NEET PG. They will ask some kind of questions is related to this thing. Okay, thank you so much.